Hi everyone, it's me, Jan again. Nice to see you. I would like to speak with you about Lamaze. Lamaze is a wonderful international organization that likes to promote healthy pregnancy, childbirth, and early parenting. This class is Lamaze based. I would like for you to know that you can always go to the lamaze.org website. There's plenty of information there for you. They have online classes and they also have a lot of refresher information. So as you get closer and closer to your due date, you can always go to their site to review things that you've learned in this class. This class is Lamaze based, so again, that means that the information that I'm going to be teaching you is evidence based. It is not just things that I think are correct or things that I've learned throughout my career. It is actually evidence-based material. So what Lamaze promotes changes over time as research changes. Lamaze promotes 6 healthy birth practices. The first one is, and this is in your packet of information, but the first one is let labor start on its own. So what do you think Lamaze is trying to get at with this? Let labor start on its own. Can you make yourself go into labor? Well, what they're speaking about here in let labor start on its own, they're talking about inductions. And induction is when a pregnant woman is placed in a facility and given medication to make her go into labor. There's 2 types of inductions. One is a medical induction and the other is an elective induction. So a medical induction means that you need to be induced for a medical reason, a reason that benefits mom or a reason that benefits baby. So examples of that would be uncontrolled high blood pressure, uncontrolled diabetes, a baby that is not growing well in utero. Let's see, what would be some other reasons? Low amniotic fluid, things of that nature. Medical reasons that indicate the baby would be safer outside the uterus than inside the uterus. And then an elective induction is when someone signs up to be induced just because it's convenient for them. So historically in this country, women did sign up for a lot of elective inductions. They would like to have their babies on Fridays so their husband would be off over the weekend, or they would like to be induced on certain days because they were very attached to one physician. But we have learned over the years that elective inductions are not a great idea. So sometimes they work out well for people, but other times they don't. So the number one things that Lamaze likes to promote of their 6 healthy birth practices is let labor start on its own. 2 is walk, move, and change positions. Walking, moving, and changing positions in labor is very natural mammalian behavior. So if you think of other mammals and how they give birth, they walk, move, and change positions. If you try to picture a horse or a dog or a cat laying in a hospital bed giving birth, it seems ridiculous, right? So the natural thing to do is walk, move, and change positions. It actually makes birth easier and speeds up the process. 3 is continuous support. So continuous support makes a huge difference in labor. It actually shortens labor. It actually improves postpartum outcomes. It improves infant bonding. It decreases postpartum bleeding. So continuous support is very important in labor. Your nurse or your doctor or your nurse midwife would love to be there continuously for you, but they will not be, okay? So you need to bring your own support person, whether that be your partner, your spouse, or a doula. But do be sure to have continuous support when you're in labor. It's very important. Partners, when you are providing continuous support in labor, that means you do need to pack your own bag for the hospital. You do need to pack your own food and drinks. Make sure you take everything you need with you to the hospital so that you can be available to your partner continuously. 4 is avoid unnecessary interventions. This seems like a no-brainer, but one thing you need to know about interventions at the hospital is they tend to, once you choose one, it tends to kind of flow into a second and a third and a fourth. They're not really a la carte type of intervention. So typically one intervention leads to another intervention. So it's best just to try to avoid all unnecessary interventions. 5 is get upright and follow your urges to push. Being upright and following your urges to push allows you to use gravity to your advantage, and it does make a difference. So being upright and following your urges to push is very important. And 6, last but not least, is keep your baby with you after birth. Luckily for you, that is the norm now, but historically in our country, babies were taken away from mothers when they were born and typically given to nurses so that the nurse could dry them off, weigh them, measure them, listen to their heart and lungs. But the baby can be very, very well managed and taken care of right in mom's arms. In fact, the baby is better off in mom's arms than being given to another medical staff member. Your baby knows you. Your baby will recognize your voice and your touch, and it will do better if it is directly skin to skin with you for that precious first hour after birth. So keeping your baby with you after birth is very important, and it is the normal thing now, especially at Mission Hospital. So all babies will be given directly to their mom unless there is a medical reason that the baby needs to be withheld. For example, resuscitation or an advanced assessment. So keep your baby with you after birth. All babies room in unless they are patients in the neonatal intensive care unit. So luckily for you, you will be able to keep your baby with you after birth. So those are Lamaze's 6 healthy birth practices. Thank you for watching this video.